Hello, everyone. This is Doug Nelson, the president of NMT Midwest, Precision Neuromuscular Therapy. And I wanted to take a couple of minutes and talk to you a little bit about testing. You know, for us, boy, that word testing is really such a loaded word, and I think it goes from a long history in our educational system in that it strikes fear in the hearts of people, and we really want to move away from that. Really, for us, testing is about just an assessment. We want to know where you are at the present moment in your skill sets. Where are your weaknesses? Where are your strengths? What do you feel really, really good about? And are there areas that in the process of testing, assessment, that we can discover where your strengths are, where your weaknesses are, so that we can truly fill and build on those areas that probably need a little more help. Without the assessment process, there's no way that we can really know that. And that is in many ways only revealed in that when you have to explain it to someone else, when you kind of get put on the spot a little bit. Because in your treatment room, while you may feel really comfortable with something, no one else is observing you from the outside going, no, that's not exactly correct. So a system can never know itself from the inside. It's really important to have that outside influence. And that's what those of us who will be, the examiners in that process, that's really our role. It's simply to help you be better. And so let's talk first about the practical part of it. In the practical testing, much of it will be scenario-based, and that's what typically happens in the clinic. So if I'm coming in, so I'm the examiner, and I might say to you, could you please show me how you would approach it if your client presents with cervical rotation that is limited to the right and also painful on the right? You can explain to me the muscles that you think are involved or what the possible reasons for this would be, but then it's also that we execute the treatment. So if we have a third person, which is really ideal, that person will get on the table, and then you will talk me through that process. You'll treat the muscles that you think are involved in that scenario and go through it at the same time. So it's not just an intellectual thing, because some people know it in their head, but they can't execute it in their hands. And some people, you can tell that their palpation skills are really good, but they're not clear about it in their cognitively. We really want you to be both, because when you're clear about it cognitively, that means you can also explain it to the client. And that's part of what we want to hear from you is if I was on the table and you're treating something and I'm a client, explain to me, what are you doing and why are you doing it in the simplest, most elegant way possible. That's really what we're looking for. And sometimes I have to say, I can tell if the person says, oh, I think it's the semispinalis cervicis on the right, good answer. But then when they go to do it, well, you can tell they're really struggling to know where they are, where the attachments are, how to go about that, because it's clear that they haven't really integrated that into their practice. That's what we want to see. And I've certainly felt that in people where they say it's this muscle and then they just boom with confidence go right after it. It's not like you have to do every single step that's in the manual. That's not really what we're looking for. But certainly, there are major players, and we want you to be able to execute those players in, again, as clear and as confident a way as possible. So scenarios, again, that might be for the cervical spine, rotation issue or an extension issue. What would it be if the client presented with thus and so? For the lower extremity, it might be something like, okay, your person comes in and points to the medial knee area. Tell me some of the things that might be responsible for that, and then show me how you treat them. So you'd say, oh, I think it could be the popliteus. And so show me exactly how you would treat that and go through that process. So, or maybe on the foot, it's the person has plantar pain. explain, again, the things that you might address and show me how you would do that and just walk through the process. So on the upper extremity, your person has restricted internal rotation and also has pain in the anterior shoulder and has difficulty combing their hair. What are things that reasonable explanations for this, and how would you triage through that, and then show me how you would treat those muscles. That's really what we're looking for. And again, we want to see it in a confident way that reflects that you've actually done that in your practice. This isn't something that you studied and you do this over here, but then in your regular practice, you're doing something totally different, because it shows when you're not comfortable with it. So we want to help you, move you to that thing where it's fully integrated into your practice. And also, I have to say, sometimes I've seen people kind of default back to their earlier stuff. Oh, it's the rectus femoris, and this is what I typically do when they're taking, their elbow, and, it's like, wow, that is not what we did in the seminars, and that's not the essence of what this work is. So, that's one of the things. We all have a default mode. What do you do when you go back to that? And part of what we want to do is, in some ways, change that default mode a little bit, just so you have many, many different options. Otherwise, we all fall back into that which we're comfortable with, and that makes improvement quite difficult. So options are good, all right? That's what training and learning is all about. In terms of the written test, honestly, the guides and the in-book tests in the back of the book are a pretty good guide for that. They're mostly, obviously, anatomy-based questions about, again, if we phrased it the other way, it would be, in our earlier scenario, name 2 muscles that are contralateral rotators of the cervical spine, those kinds of things. So think much more anatomy-based for the written questions, and think executing some of the techniques that were shown in the seminar. And again, we're really flexible, as always, through the technique part of it. So if you're showing us something and you say, you know what, when I treat this particular muscle, I really like to do it in this position. That's not what we showed in the seminar, but here's why I do that. And then it's clear that not only have you integrated that material, but you've taken it up to the next level. And that's ideal. So this whole process is just to help you be a better therapist so that you can help more people. That's really what it's all about. So I have to say, one of the most disappointing things for me is therapists out there who really know the work, and they just haven't gone through the process of the testing process with us. And what's disappointing about that is that I know there are people out there who are really great at the work, but when we get people calling and emailing us, say, do you have a therapist and whatever, I don't really know who those people are. I know that people showed up at a seminar, but I don't really know that they've integrated and mastered the material. And I know that when I see their name marked off and that they've tested over that material. So it's really our only way to be able to refer to you. And we get more and more people specifically asking for precision neuromuscular therapy and therapists who can execute that. So please take the time to do that. I think you'll enjoy the process. It's not about the end goal, it's about the process, and the process is what makes you a better therapist. Thank you so much for taking the time to watch.